So we're going to talk about staplers next. We have a wide variety of staplers that we use in surgery. So our two most sort of common, easiest ones are our skin stapler. There are two different sizes. There's a 35 and a 35W, which just means the staple that comes out is slightly wider. They generally don't mind which one you give them, but if they ask, you know that there are two types. They're kept in Theatre 3's glass cupboard. Then moving on to our Surgiclip. It might also be called Hemoclip. Basically, this is able to clip off vessels. So you can see it's kind of got like little teeth down there. And when the surgeon pulls in these two handles, it clips down and it will occlude a vessel. You can actually see how many staples are left by looking along here, so you can tell if it's fully used or not. We will reuse these until basically the staples are all used up. And that's the same as this product as well. These can both be EO'd. So moving on to sort of like slightly bigger staplers and staple units, we've got our two TA units. So this is TA30 and it's a red colour, and this is TA60 and it's a blue colour. So that's kind of your easiest way to remember. If it's a brand new unit, it comes pre-loaded. If it isn't a brand new unit, you need a cartridge, and these are all kept together in the white soft tissue cupboards. Make sure you have the right cartridge and you have spare cartridges with you. So you can see red tip, red tip. So it is quite easy to see. If you need to double check what size, just look on the other side. So 30 V3, 30 V3, and then 60, 3.5, and then 60, 3.5. The way the surgeon uses this is it allows them to, if I show you a little picture, create a line of staples through, for example, a lung lobe, and then they can cut the other side of the staples away from where the patient is. So you then isolate part of, if this was the bottom of your lung, part of the lung off, you can staple it and then you can safely cut along this line here, and it obviously stops any bleeding because it's like ligated it basically, it stopped it bleeding. So they will ask for these in surgeries like that. I always try and have them ready if I think anything like that's going to occur, because it's just easier to have them there with you. There's not really much else. The surgeons know how to work them. They all work from the handpiece, so you don't actually need to do anything to them. You don't load them, the surgeon will load them. You just have to offer them cartridges. Okay, this is quite a unique one up here. So mainly this is Matteo that uses this one. It's called an endolinear cutter. So again, this one staples and cuts. Oh, sorry, this one staples and cuts, whereas the other one's just stapled and then you had to cut. So this one has cartridges that look like this. They load into one side of the unit. And what they do is, you'll see that they produce two lines of staples on either side, and then down the middle, the actual unit then cuts. So you're able to divide tissue and cut. Whereas with our other staplers, we were just able to staple rather than cut. So that one is an endolinear cutter, and again, that's kept in the white cupboards, and so are the cartridges, so they're all kept together, and that can be EO'd. Onto the GIA stapler. So this is mainly used in intestinal surgery. Again, these can be reused up to 6 times. They're EO'd. And then we have spare cartridges. So when we re-sterilise them, you don't put cartridge in. You give the surgeon the cartridge. So as you can say, C60, 3.8 millimetres, and that's the size of this unit. We only have one size of unit, so it's fairly simple in terms of that. They're stored together again in the white cupboard. So that's for intestinal surgeries. They will ask for them, and we've got quite a few of them, so they might have to go through them. They are a little bit funny to use sometimes. Okay, and then on to our last one, which again is a Matteo special really. It's known as Ligaclip, and in fact it's very, very similar to our original Surgiclip. It's just got much bigger teeth at the end, so it can go around much bigger vessels, and obviously it also has a much longer stem. But basically this is a size 12, and then this is a size 11.5. Different brands, but it's just they much prefer, they've asked for it for a long time, this Ligaclip. They much prefer the bigger end because they feel that they can ligate things better and it's safer. So this is kept in the lap cupboard. Turn it around the right way. And we have several of these, and again, these can be used until they run out. I have been told, Matteo said he will tell us when they're run out, but also you get a little orange dot down here apparently when all the staples are used.